Hey, I'm Dr. John Minichetti. I'm one of the co-chairmen of the American Academy of Implant Dentistry, AAID 2025 annual meeting. It's going to be in Phoenix, Arizona, November 12th through the 15th. We are so excited. We have so many great speakers, and one of them is coming in from Spain. I love it. Dedication. I got her on the line because I wanted to talk more about what she's going to be speaking about. This is Dr. Samantha Siranli. Those of you who don't know her, she's board certified in dental implantology with our American Board of Implantology. She's also board certified prosthodontist. She's got a phenomenal business and practice, and she's out there every day treating patients and restoring smiles exclusively in implant dentistry, and she is cutting edge, and we are so happy to have you. Welcome, Dr. Siranli.
Thank you so much, Dr. Minichetti. You are so kind. Thank you.
Of course. So
It's
listen,
my honor to participate.
well, it's our honor to have you, of course. So you're going to be on the main podium. You're going to be talking about digital workflow for the full arch restoration with Smile Designs. Tell us more about your main podium presentation.
Okay, so we will start with, with the smile design, where we want the teeth to be, where we want to finish. We will start with the finished product, talking about the smile design. And from there, we will talk about the surgery, but mainly we will be focusing on the prosthetics. And the day of the surgery, how we pick up the right abutments, and then how to completely digitally finish the immediate loading on the implants. We will learn about, or I will try to present a lot of case samples with photogrammetry and intraoral scans. And also we will talk about how we merge the initial scans of to the post-op after the surgery scans.
Beautiful.
I put a lot of cases, tons of cases into the presentation.
I've had the
So
pleasure.
it's not boring.
Yeah, I've had the pleasure of seeing some of your cases, and they are beyond spectacular. So you certainly have this thing mastered. Tell us about the workshop you're going to do, because I think you're doing a hands-on workshop also. What are you going to be teaching, or what kind of models and stuff are the participants going to be able to get to work with you if they sign up for your workshop?
Perfect. So in the workshop, the participants will have the jaws, the typodont jaws. And then I will be teaching them a little different technique, which I love that technique each time, that helps us not to lose the vertical dimension of occlusion or not to get lost in space. So I call it half scan technique. So basically, the models, the typodonts have teeth. They are going to learn how to, extract the teeth basically on the models, and bone leveling, implant placement, scanning, and then converting to the other side. So each one of them each participants will be placing the implants. They will pick the abutments. I will teach them how to pick the right abutments. From there, we will all do the hands-on intraoral scans and hands-on photogrammetry. Photogrammetry is the latest thing now, and everybody wants to learn. And so the participants will practice with that.
Beautiful.
And then hopefully with the computer, we will show them the design, and hopefully we will be able to, if the time allows, we will be able to print one or two, maybe, if the time allows.
That's great. So you're gonna have some printers, so you're gonna have some equipment there. Wonderful. You have the photogrammetry units, computers, printers, and everything you need to scan. Wonderful. Wonderful experience. So tell us now, okay, so you're giving a great main podium and you're giving this workshop. Tell us though about the AID meeting, because you've been at a couple of them before, and I know you're doing a lot of stuff. So you work with the board examiners and stuff, but tell us about the AID. What do you think a participant who wants to sign up for AID meeting is going to get out of the meeting?
Honestly, AAID meetings are the best meetings. I used to go to my pros meetings. I promise you, I stopped going to them. I just follow all the AAID.
Well, wait a minute. I don't want to make enemies on it. Oh, that's great. Oh my God. So they are exciting, are they not?
They are very exciting. People are very warm, kind. The material, the lectured material, the teaching material is absolutely amazing. And everybody feels so comfortable, ask their questions, learn more. It's just friendly. Basically, a big growing group, an amazing group, international group. It's just the best meeting ever out there.
Well, thank you so much. They do say that we are the AAID family. And I do
Yes.
want to recognize that you are really one of the up and coming stars in as a woman in implant dentistry. This is something that is kind of new because, when I was first with the AAID 30, 40 years ago, there weren't too many females around, I have to say. And what do you have to say for the women or females who want to get involved with implant dentistry?
I encourage them to get involved more and more, especially with this group. It's just very comfortable. Everybody supports women a lot. And I encourage all the females to join and to do more and more surgeries, to do more and more implant restorations. With this group, honestly, when I first started with the AID, I was myself honestly very intimidated. I was worried. I was worried about asking my questions. But this group is something else, makes you so comfortable, literally leads you to the best you can be out there.
Yeah, so this year we're going to be having, as we have in the past, the Women's in Dentistry get together. We're going to have a social. I believe this year it is actually a luncheon on Friday. So, and I know you've been participating with those women's socials. What does that do? What is a women's social like? I haven't gone, but I know my daughter's going this year. So tell me, what are the women talking about?
So the same thing men's talk about. So we talk about, it's like little different than men. We also talk about our families, the offices, how we run the offices, how we, learn, we encourage each other. Yeah, you can do this. I did this. I was there. I just gave a birth. Those kind of things, little bit more, I guess, the talk about the family or babies things, but
Mhm.
still a lot of implants, a lot of encouragement, and we support each other. We say, you go, girl, you can do this type of thing.
Thing. It's good that you need that. We all need that support. We live, us as dentists, we live in our own little world, unlike the medical society where you're all in the hospital. We're kind of like doing our own thing. And it's nice to be able to get together and say, oh my God, that happens to you too. Oh my gosh, you can laugh about it. So that's a wonderful thing. I know my daughter's going to be there at the luncheon for sure. She's got to have a couple of her colleague friends. And yeah, we're encouraging that, sincerely encouraging the younger generation, women. We are an all-inclusive academy, and I want to thank you so much, Dr. Siranli, for participating and being a part. Certainly one of our future leaders of this organization. I want to thank you so much for all you've done for implant dentistry.
Oh my gosh. Thank you so much, Dr. Minichetti. You are the best mentor out there. You're amazing.
Oh, thank you for the kind words. And don't forget, check it out, November 12th through 15th, 2025, Phoenix. Go to AID.com, register soon. Encourage your friends and colleagues to register. Thanks
Of
so much.
course. Of course.